Thank you, Mr Dowden. It's a pleasure to serve under your chairship today, and I'd like to thank the member for Ashfield for securing today's important debate, and my thoughts are with all the families whose experiences he shared today, and with all those who've shared their own personal experiences in the room as well. This is an issue that is both deeply personal to me and one that I've spoken many times in the last 5 years about, and I'm sad to say I've not yet had my rainbow baby, but you know, it doesn't stop questions every single month for probably the last year of asking if I'm pregnant, which I would encourage colleagues not to ask women, because it is not only very rude, it can cause a lot of heartache for those who are struggling to conceive. I've had the honour of working with dedicated campaigners, including Myleene Class, and we were privileged to welcome the former Minister for Women's Health to Tommy's at the Women's Hospital in Birmingham. And it was great to get them there. And I'd like to extend that invitation to the new government's health team to see the research that has been done there, to see an alternative model of care which would see the end of the 3 miscarriage rule that has since been piloted in response to the review, but also to meet the families of those who Tommy's have helped to have their rainbow children. And it was incredibly rewarding to hear their stories about how the small differences in care can really make that difference and allow people to have the families that they so desperately need, whilst remembering the children that they were unable to hold in good health. And, you know, it's been brilliant to work with Tommy and Sands for several years, pushing for meaningful and long overdue changes, because it is estimated that 50% of people will be affected by baby loss during their lifetime, either personally or through someone they know. Miscarriage is common, but that doesn't make it any less heartbreaking. And often this leaves women facing grief in isolation, as well as men who have gone through this as well. We've been trying hard to break the taboo, increase support by employers, establish bereavement leave, better mental health support, because there is none in many cases, but most importantly, improving that pathway of care, for pushing for more early intervention for women who may be at higher risk, such as myself, who had undiagnosed diabetes, and also funding for research to make sure that we're doing all that we can to improve the life chances of people who are going through pregnancy. In the UK, 13 babies tragically die before, during or shortly after birth every single day. National reports indicate that up to 1 in 5 of these stillbirths and neonatal deaths could be prevented if guidelines were simply consistently followed. That's simply not good enough, and these deaths are not mere statistics, but heartbreaking losses that call for our immediate attention and action. And I'd like to highlight the progress being made in addressing the challenges in miscarriage in response to the independent pregnancy review, because I think it's important that we show that there is more that can be done here. We've touched on the 3 miscarriage rule, but that's really important that we make sure that the ending that is rolled out successfully. We've seen the pilot that we are waiting for the results of, but I'm hoping that this government will take seriously that change in model of care, which is not only backed up by research. That 3 number was picked out of mid-air by all accounts. There is no reason why someone should have to wait to have 3 miscarriages before they get basic tests for diabetes or for other reasons to understand why they may have miscarried. It is cruel. You wouldn't expect anyone to have 3 heart attacks before you did a basic test. You know, it is laying bare the kind of sexism, I suppose, in our medical system, that we would want to allow people to go through that so many times with so much loss and so much trauma before we would give them the answers that they need to perhaps go on to have successful pregnancies. The review also provided 73 recommendations across various areas, including the graded model of care, which would be the alternative to the 3 miscarriage rule, supplying people with the support that they need from 1 miscarriage, which is currently being trialled, as I say, at Birmingham. Another vital recommendation is 24/7 access to miscarriage care. At the moment, depending where you live in the country, you may have access to an early pregnancy unit, you may not. You may not have any access to information if you are suffering a miscarriage or what to do in that situation, leading to people turning up at A&E or staying at home and losing a child unnecessarily. This is a critical measure to ensure that no one has to navigate the painful experience alone, and is something that I would love to work with the government further on how we can develop this in an affordable but successful way to reach all communities, whether they're rural or in a city. However, there is one important area that I feel has been left out a bit from the conversation, and it's been touched on today, and it's about data collection. Now, it's vital that we understand the issue, and there has been a push for systemic recording for all miscarriages to understand the true scale, because the numbers that we quote today are unknowns, really, because we haven't been doing this systematically. And I experienced being called for my flu jab, and when I was a bit bemused by this, and asked why I'd been called for my flu jab. And they said, oh, it's because you're pregnant. And then they looked down and then realised I was not pregnant and said, oh, wait, you're not. And that was a very difficult thing for me to go through. They did give me the flu jab, which is quite funny, I suppose. But it was really hard for me to go to that appointment and to hear that. And I know that a lot of my constituents have been asked if it's their first child, or how their other children are doing, because the notes are just not there, and the way that miscarriage and baby loss is flagged on their medical records is not sufficient to stop those kind of awkward and very upsetting experiences for women who've been through baby loss. And we want to get those national statistics because we truly want to understand the true picture, and that will allow us to set targets and measure the impact of interventions that we so desperately need to introduce. And while the previous government's commitment to 20 short-term actions, including some of the issues that I've kind of highlighted, is a positive step, it is deeply concerning that families are still having to face, the trauma of multiple miscarriages before receiving those investigative tests, but also the mental health support. And that is something that I think is not fully understood as well. And you're more likely to suffer from PTSD, depression, suicide. These are all very material issues for families who've experienced one miscarriage, never mind the trauma of 3. So I hope that the government can look into this issue in more detail. We've kind of heard about the issues of inequalities, but black babies are more than twice as likely to be stillborn, and black and Asian babies are over 50% more likely to die shortly after birth compared to white babies. And we have high rates of child fatality and high rates of miscarriage also reported in the Gypsy, Roma and Traveller communities, and this disparity is unacceptable. And I urge the government to renew and extend the national maternity safety ambitions, setting clear targets to reduce these inequalities. And I know I've welcomed the reviews of these 2 areas when they were brought by the last government, but I hope that we can learn the lessons soon and get action for those mothers. Every baby deserves an equal chance of survival. It shouldn't matter what your background. And we must also focus on improving prenatal care, and this is an area that, again, is not given enough information on. And I think, early and regular antenatal care is critical, but if we can provide advice, guidance and support for women who have disabilities and illnesses, we can help them have safer pregnancies. But we still know, and we've heard today, that the basic care still isn't there for many people, and that is a gap that is essential for us to focus on. We need to ensure that every expectant mother has access to timely, high-quality care, regardless of their background, as I've said, and alongside this, addressing health inequalities is absolutely crucial. Babies born into poverty are sadly more likely to die by their first birthday compared to those born into wealthier families, and this disparity is a stark reminder of the broader social determinants of health that contribute to infant mortality. We must tackle these inequalities head-on by improving access to healthcare, education and support for all families, particularly those from disadvantaged communities. Preventable baby deaths are a tragedy that we have the power to address and prevent. While we've made important strides, more work is desperately needed. I urge this government to commit wholeheartedly to giving every baby the chance to thrive and ensuring every family receives the essential support that they need throughout pregnancy and, unfortunately, throughout baby loss.